All right, Diane, thank you so much. Let's go ahead and bring in Dr. Michael Caldwell, professor of public health at Meharry Medical College School of Global Health. He's also the chief medical officer of DryJanuaryUSA. That's the charity that launched the Dry January movement here a decade ago. Dr. Caldwell, thank you so much for being here. So what does this new guidance mean?
Yeah, no, Gio, this is historic, just as important as the announcement in 1964 that tobacco was linked to cancer. I, as a researcher and many others, have known about this link of alcohol to cancer, but the evidence over the last decades and even in the last decade has built to the point where now the Surgeon General has made this historic announcement. What really struck me, Gio, is that 55% of Americans did not realize that there is this increased risk of cancer with drinking alcoholic beverages. Now, I have this glass of water here. If I told you this glass of water might increase your risk of cancer, would you drink it? Well, same with alcoholic beverages now. We want to get into that knowledge gap because knowledge is power, and we don't have to give cancer a head start.
And that is so fascinating that you say 55% didn't know. I think a slew of Americans just did not know this. But also, we're talking about 72% of Americans who consume one or more drinks per week. So when you think about the idea of putting a label like the one that we see on cigarette boxes on alcohol, do you think that would have any impact?
There's no question. Gio, in 1964, only 45% of Americans really understood the risk between tobacco and cancer. Now they're up to 90%. When I saw the Surgeon General talk about 100,000 cases of cancer linked to alcohol each year, I thought to myself, that could be potentially 100 less conversations between a doctor and a patient to say, you don't have cancer. How wonderful that could be. This is really historic. I think the evidence is conclusive. We need to be transparent and give the public information, let them make their own decisions.